Currently, 49 of the 50 states in the U.S. are suffering from a severe flu epidemic. This follows what was also a severe flu season in Australia and mirrors the epidemic levels of flu now being reported in Britain. In Belize in December, the Ministry of Health reported an increase in flu cases. And at this time, Director of Health Services Dr. Marvin Manzanero says the number of flu cases in Belize are as expected.
And we haven't seen a spike in terms of acute respiratory tract infections, which is all not only viral but bacterial cases. We haven't seen that. We only saw the spike on the Cartusia and the central region reported in the latter part of last year. We would still be in the flu season, and that perhaps answers the question. So we really can't let our guard down. So from now until the end of March, beginning of April, we do expect to still have an increase perhaps, but we have not detected any increase out of the norm. So we are in the flu season, which means we need to take the necessary precautions to ensure that we don't have an outbreak.
For head of pediatrics at the KHMH, Dr. Cecilio Eck, in both the public and private settings, he has been advising parents to be vigilant with their children, especially with the epidemic reports coming out of the U.S.
We should hope for the best but prepare for the worst. This specific strain H3N2 is pretty bad, and when you look back at the literature and the history of it, the last time this happened a couple of years ago in the U.S., yes, and in Belize we had more cases of severe illnesses reported and more deaths.
How often do you see flu-related deaths?
In Belize it varies with each year, but yes, each year we do see flu-related deaths. If it's not the virus itself that our body cannot deal with, then the complications is what kills us, and you're completely right. We get simply, it would start with a fever, the constitutional symptoms, loss of appetite. You feel in Belize, they say, broke up, bone pain, stuffiness, and headache, fever, all that. But then your immune system becomes weakened. And I call them opportunistic bacteria that would jump in. The mucus that is produced in the lung, get infected. Your body becomes infected in the lung, and what usually kills, or is the final episode, is a pneumonia.
Dr. Eck recommends getting a late season flu shot if you didn't do so before the start of the season. While this year's shot may not be perfect, it's better than nothing.
Parents come and ask me, I said, Doc, it's only 10% effective. Why take it? I tell them I would take a 10% discount over 0% off. All day, all night, especially to the vulnerable.
Who is most vulnerable and why?
Well, remember, this virus will attack everyone. Who is most vulnerable would be the people who don't get the vaccine, but even without the vaccine, the young kids, anybody less than 6 months, the elderly, anybody with a chronic illness. So in pediatric population, I would tell you the kids with asthma, the kids with diabetes, the kids with sickle cell, that's high risk. All school-age kids as well, because they don't practice as much hygiene as me and you would.
Also vulnerable are parents of school-aged children, healthcare workers, and in general adults who regularly come in contact with a lot of people. Vaccines are still available at public health clinics for free and at private institutions for a cost. While the ministry keeps monitoring, the advice is to maintain good hygiene, wash your hands, cough in your elbows, and visit a doctor if you have flu symptoms that last too long.
If you feel very ill, stay home from work or keep your kid home from school. Give this simple cough, cold remedies. But if those don't start to work and the kid or you start to feel worse, visit your healthcare professional or your clinic and get seen.
I guess we just have to be on the lookout. We are monitoring, we do weekly trends in terms of that, and if anything comes up, we'll surely be alerting the public in that regard.